Hi everyone, my name is Robert Versteeg. I have a master's degree in social work and currently working on my doctorate degree in social work at Capella University, and I want to talk to you about an often overlooked, disenfranchised group of people in American society, which is the elderly, gay, lesbian, bisexual, and transgender people. From here on out, I'm going to call them the LGBT people. That's the acronym. Um, a lot of strides are being made in America for equality for LGBT people. Many states now have same-sex marriage legalized, and even recently the Supreme Court overturned DOMA. However, there are still many things to fight for, and institutionalized homophobia still exists. Um, Besides that, the elderly in general are a forgotten and often silent group in society, especially American society, so focused on youth. Um, Unfortunately, even within the gay community, they are a forgotten group. For example, I have a couple of magazines here. This is Hotspots, which is a local magazine. Look at the cover. And here is one that's called Wire Mag. All right, and this is Guy magazine. These are all local magazines, and as you see, all the covers are of young, chiseled, attractive men, um, and that's what the gay society's community is very focused on. So it's time for us to also start incorporating our elderly, because we're all getting older one day, and we don't want to forget ourselves. That's what it comes down to. But the LGBT community will have to start addressing this themselves also and value their elder LGBT people. There's research being done that they've also been excluded from queer theory, like they've been excluded from the gay community. So elder LGBT people face dual discrimination, homophobia, and ageism. And this is especially rampant in the healthcare field. I've worked in skilled nursing facilities since the year 2000 as a social worker, and over the years I've started to see more openly gay and lesbian and bisexual and transgender people come into healthcare. And healthcare doesn't really know, they're not really prepared to deal with this group, which often forces them back into the closet, which they came out of years ago. Um, there's a gentleman called Ritter. He wrote an article, Quality Care for Queer Nursing Home Residents, and he states that across the country, nursing homes are ill-prepared to offer effective care to the influx of gay elderly patients that they will see in the near future, because baby boomers and out gay older people are going to be more and more in those facilities. Going back into the closet is not a good thing, especially if they've been dealing with coming out their whole life towards their family and they finally established a gay identity, but then they find themselves facing homophobia again when they enter a new nursing home or an assisted living. Um, there's a female, her name is Wolf, in her article Gay and Lesbian Aging. She adds that the healthcare system has traditionally been unresponsive to recognizing the existence of gay and lesbians. It's traditionally very based in heterosexual thought. Um, there's some statistics here. 13% of recently there was a survey done with elderly LGBT people, and 13% of them reported that they were being denied care. 20% were not out to their doctor. 34% had no legal protection. 40% had suicidal thoughts, and 64% reported being victimized 3 or more times. These are staggering numbers. And they need to change. But like I said, change needs to occur from both sides, both by the LGBT community and the elders. They need to speak up and feel free to come out, as well as the healthcare providers. Locally, there's an organization called SunServe. This is their logo. And it's an LGBT agency, social service agency. They have started a training which I am involved in. We provided to staff of nursing homes, assisted livings, home care agencies, geriatric care agencies to make them more aware of issues that are being faced by LGBT elders, and for staff to be more sensitive towards issues. So there's 3 trainers that go out, me and 2 other gentlemen, to facilities to train the staff. and then we certified that facility to be LGBT sensitive, so they can advertise as such, and also SunServe will advertise them as LGBT sensitive healthcare providers, so the gay community knows where to go when they need healthcare, and they won't have to face as much homophobia. If you are interested in this training, you can visit the SunServe website, which is www.sunserve.org. Here is one of the slides from the training, and if you can see that, there we go. It's culture, needs, and concerns of LGBT older adults. It's a 3-hour training, and the message of this post here on YouTube is really that LGBT people do not need special treatment. We just want them to have equal treatment. Equality is a right from once you're a child, through adolescence, through productive adult life, into later adulthood. And we all have a part in that to make that happen. That's it for now, and thank you for listening.